Okay, let's come back over to this side of the studio to another return guest on the show, Tara Kulash from the St. Louis Post-Dispatch. We established last time this must be a newsworthy topic because you've created a beat just for this issue, and this is your beat. We had you do, you played the role of fact checker last time. We'd like to ask you to do that again. So I've got a couple of questions for you, but I see that you've got a couple of things written down on the reporter notepad.
Yes.
What stood out to you tonight?
Okay, well, I think a couple things is, first they were talking about how people are getting frustrated that, first of all, you've got all these glitches with the website that are keeping people from getting signed up, but the people that are making it on are putting in the wrong information and it's getting mixed up. Well, I think a key factor with that is a lot of these people that are signing up for healthcare on these websites are not tech savvy. Obama, in his presidential campaign, went for more of a digital kind of feel, used the internet, and that was to target the younger audience, and that worked for a presidential campaign. When we're talking about healthcare, it's a lot harder to sell that to young people because they think they don't need it and they can't afford it. So
they're not passionate about healthcare like they might be politics.
Right. Now the people who are passionate about healthcare are the older and sicker who are either not making as much money and so they don't really have internet access, or they're older and they haven't caught up with internet and they hate it and they don't want to use it. So now they're having to use this platform that they don't really want to use and they can't really figure it out very well. So, I mean, navigators are a good thing. They help them out, and I definitely recommend talking with one.
And tell us what a navigator is. That's an individual you're talking about here.
There's different kinds. So a navigator is funded by the federal government, and they are to help people get signed up for insurance online.
And if one finds a navigator, how?
Oh, there's lots of different locations. I could tell you if you go to covermissouri.org or getcoveredillinois.gov, they have navigator locations listed on there.
And 9net.org/health.
And Mo Health Report.
You got it. Okay, go ahead. So I'm sorry, I cut off your train of thought there. I apologize.
Okay, and then there's certified application counselors, which they do the same thing, but they're funded through grants or private organizations. So they do all the same thing, it's just kind of different titles. And then there's also another one that's in-person assisters. Same thing though.
Okay, back to the reporter's notepad. What else stood out tonight?
Oh, okay. So also another thing that's really important is people are upset that they aren't getting a lot of information about this yet. Well, something that's really important is big campaigns, state campaigns, Illinois' campaign, Missouri Foundation for Health's private organization campaign. They're holding off on their mass media launch at the moment because if the website isn't working, why would they try to direct people to it? They are focusing, they're still campaigning, they're focusing their attention on education and awareness. So they're just trying to reach out to people, having meetings, being active on social media, and Get Covered Illinois is about to launch an educational campaign.
So once they get the kinks worked out, as a lot of people here tonight believe they will on the website, we're going to see more of a flood of information on a traditional campaign, you think?
Oh yes, you're going to see print ads in newspapers, digital ads online, Facebook ads. You'll see pre-roll ads before YouTube videos, the little 15-second advertisements, radio ads, so television ads too, obviously.
Talk about, let's go back just a couple of conversations when we started to hear about how recently in the news the urgent care that closed here locally and the predictions we heard from the table that's going to continue to happen throughout the state. Are you seeing any of that in your reporting, any of the effects of that gap that we're talking about, of the not having Medicaid expanded in Missouri?
Oh, definitely. These centers that rely on grants are suffering, and hospitals that aren't getting pay from the government anymore. It was when they formed the Affordable Care Act, the idea was that states were going to expand Medicaid, and so that would take up the coverage for these people that couldn't afford it. And so the federal government stopped this pool of money that it would pay back to the hospitals. So now the hospitals aren't getting anything. So they're really suffering. Are
we suffering because of that? Is that going to have an impact on those who don't depend on those resources?
I mean, if you work there, yeah, for one thing, it's loss of jobs, and then also it could have an impact on hospitals getting into insurance networks too. I mean, there's a lot going on, and a lot of it does have to do with the Medicaid expansion. But then you see this positive stuff going on, how you have pharmacists and other people that are going into the primary care now. You've got nurse practitioners are taking it on more. Like Chinooks, for example, they just opened an Infusion therapy center. So, and like they said, it's health reform that pharmacists are becoming more following up with the patient, because for cost control, they're wanting to keep people out of hospitals more.
Final thought, we have just a little bit of time. Anything else on your notepad that you want to make sure we get right tonight?
Okay, this is kind of funny but interesting, I think. Everyone gets really upset over this, and they say that Obamacare is dead, that it's ruined now because of the glitches. Well, it's also really important to remember that Medicare had a really messy rollout too. It was depending on people being able to come in and prove their age, and most people at that time didn't have birth certificates. One guy had to bring in his mother's tombstone to show when his mom was born and died, and insisted that that proved that he was old enough.